Today I am going to teach you two remedy, Kali and the Viretram. Mostly on the mental part only, mind only, how the evolution take place, how since from birth to adult. Because every individual with situation and circumstances react differently. I try to give you a audio visual presentation, not on PowerPoint, but through my lecture. You can imagine, like whenever, see nowadays the audio visual had come. Previously, whenever we used to read the novel, a good writer will describe the everything in such a way that you can imagine everything. Even if you want to describe this lecture hall, will say one video camera was there, he was looking down, and you have it known as a book picture. The picture will be in front of you. I will try that. I used to teach all this drug in my college. All these students, since last few years, I am only taking medicine. But Materia Medica is my passion. When I was a student, I made one formula: eat materia, drink materia, sleep materia. And I tried to did some innovative way of teaching Materia Medica and remembering Materia Medica. Because as a student, I know what are the difficulty. And as a homeopath, all the homeopaths remain students throughout their life. I think last lecture what I took here about a rare drug, the first line I said, there is nothing like rare drug. The drug which you don't know, it become rare. And more you grow, more you read, your knowledge of Materia Medica increases, your rare remedy become less and less and less. Now we start with a very important drug, Kali. It is said that it is very difficult to understand a Kali patient. It is very difficult to understand the Kali patient. Even today also student comes and tells us, sir, please tell us about Kali. We are confused. Natram is very easy. Natram is very easy and you will get lot of natram. You will find every alternate patient natram. Everybody is having suppression or brooding or something. In practice, to find Kali is also not so easy because you have to go more and more deeper into case taking. Now what is Kali? It is a potassium group. It is a potassium, correct? Like sodium, potassium is also very, very important for our body electrolyte balance. If it is more, then also a problem. If it is less, then also a problem. If it is less, if there is a deficiency, the commonest symptoms patient will get it, severe cramp. Or something like paralysis type. This is known as a periodical paralysis, known as paralysis. Patient is not able to walk due to deficiency of potassium. So much of weakness, both cramp and weakness. Now if you read Kali physical symptoms, the one of the most important symptoms of Kali is weakness. Even this deficiency can cause lot of cardiac problem, cardiac arrest. If potassium is more, again it affects the kidney. When the kidney is not functioning properly, because of chronic renal failure or something, there is an electrolyte imbalance. Now the patient is on dialysis. Only creatinine is not important to continue dialysis or to start dialysis. The most important thing is potassium. Then comes sodium. Therefore, it has lot of action on kidney also. Therefore, you take any kali carb, kali chlor. Now, it is said kali chlor is almost specific for nephritis. While kali carb is one of the very good remedy for nephrotic syndrome. What is the constitution of kali patient, kali carb patient especially? Obese, correct? Obese. Then there is a edema is there. Where is the edema? Upper eyelid, correct? Therefore, both the eyelids, especially upper eyelids, are swollen. Lower eyelid, which drug? Apis, very good. And both the eyelids and arsenic. Now all these drugs, apis, kali carb, phosphorus and arsenic, they all are having kidney problem. It has, all these drugs has great affinity for kidney. You know apis, of course, you know phosphorus and arsenic also. Now this is known as correlation of your Materia Medica with medicine. The correlation of Materia Medica symptoms with medicine. Now, another drug there is lot of edema on the face is ferrum. Ferrum. But in ferrum, it is because of anemia. And there is a false plethora. Patient gets up in the morning with lot of puffiness, full face and slight congestion on the face so that it becomes look red, looks healthy. This is known as a false plethora. Therefore, kali has affinity for heart, muscles, nerves, kidney, GI tract and female reproductive system. Female reproductive. We are talking about kali carb mainly. Respiratory, I forgot to do respiratory. Respiratory also. Not so much. Now, I will take you to an imaginary world. You have to imagine what I am telling. Don't write. Now, we are going to one imaginary world. We are going to one marriage ceremony where Mr. Aurum is getting married to Miss Calcaria. What is Aurum? What is the characteristic of Aurum? Very consciousness is consciousness, then a lot of honesty, truthfulness, correct, and absolutely satisfied with the life. Whatever he achieved, he is satisfied. He is not like Lyco or he is not like Viretram. Basically, he is satisfied. This is one part of Aurum. There is another part of the Aurum is also there, which I will tell you while I do Kali further.